This is part 2 of the comprehensive model of grief and loss, and we're going to talk about regret therapy. So we went over the actual model and how regret plays a role in complicated grieving. So when we think about how to address this in therapy, whether it's individuals or whether it's group therapy, the first thing we have to do is understand that this is the issue and to identify the issue. So we use everything else we covered in this module in Wharton. So we start with Rogers person-centered, we move to some Gestalt, and the overall concept is existential therapy. We make sure to reassess, to make sure there's any comorbidity. Are they self-medicating? How is this playing out in complicated grieving? Are there psychosomatic issues? What's going on with all that? But after all that, part of this process is to identify what the regrets are and to connect other associated feelings that are also a result of regret. Along with that, to figure out exactly what happened in the grieving process. Did it begin? What happened? Did it never complete? Did they get stuck? Did it never begin? What role did regrets play in this overall experience? But now I want to focus on how do we deal with the regret and how do we help them to find meaning, to reestablish concept of relationship with other, and to continue to move through the grieving process. So what I find to be most helpful is a 3-step process. The first step is a role play, the second step is role reversal, and the third step is what I call personification of the feeling. This includes aspects of Gestalt therapy, existentialism, but also a little cognitive behavioral or REBT when we talk about negative self-talk related to feelings and regrets. So the one thing is, regrets are not part of the present. Okay, they're either in the past, things we did, things we didn't do, committed or omitted, things about the future that will never happen. Not having the ability to live in the present because of those two types of regret. So we process the regret itself. I get a narrative from the client depicting what happened, what didn't happen. So they tell me a story. They tell me what the reaction was from the deceased, what their reaction was. We process the whole regret. We use a combination of Rogers person-centered and narrative therapy. The next step, I talk to them about doing a role play. And in that role play, I want them to imagine me as the deceased individual, and I want them to call me by the deceased individual's name. And I want them to say in that role play, whatever is unfinished, I want them to express the regret, an apology, whatever was not expressed. I'm sorry I did this, I'm sorry I didn't do this, whatever it might be. And I want them to express both the regret and what they'd like to say about it to me. And imagine that I'm the deceased person. Use my name. I don't respond. We get up out of our seats. We trade seats. I am now my client, and they are the deceased individual. This is the role reversal. This is the second part of the process. I ask them to respond as they believe in their hearts and minds that the deceased individual would respond. Now, I do need to clarify that if this was a violent or abusive relationship, and I don't believe that the individual would have responded positively, we have to go a different route. But 9 times out of 10, if it was a loving relationship, even though if there were problems, this is probably the way to go. Normally the person would respond because in their hearts and minds, they know the individual loved them. They love that individual. Even if it's a pet, pretend your pet can talk. And I have them express a number of things. How would they respond to what they just said? Well, thank you for apologizing. You know I loved you. You know I would forgive you. You know I do forgive you. The second thing I'd like them to respond to is, what would they like? What would the deceased individual have liked them to do now? How would they have liked them to live their life? And most of the times they would say, you know I want you to be happy. You know I don't want you to dwell on this. I want you to go on. I want you to live a full, happy life. In the present. A meaningful life. So one of the things that has to happen is, even though deep down the client knows these things, they have to verbalize it out loud so that they can own what they already know and believe. The final aspect is called personification of the feeling. We switch roles again, we get out of our seats, we go back. This is a little more complicated. It takes a little more imagination. I want them to explain to me what negative self-talk goes on in their head. They're constantly kicking themselves as a result of this past-related regret or future-related regret. I should have, I would have, I'm never going to be able to, can't believe I'm a horrible person, whatever it might be. All this negative self-talk. So I want them to choose the most meaningful thing that they said as the deceased. I love you. I forgive you. I want you to have a happy life. Something like that, whatever it might be. So that even though we've processed this, they know, they understand, the negative self-talk will probably return. But each time it returns, it'll be to a lesser degree. And now they have an empowering statement that they can tell themselves in their mind next time they find themselves saying these negative things to themselves in their minds. And I want them to practice stating this out loud to themselves. So I pretend that I am the personification of the regret of this negative feeling. I am this feeling. I say to them some negative things that they say to themselves in their minds, and they have to defend themselves using the most empowering language that they gleaned from the role play and role reversal. So if I say something like, and I don't mean this, I tell them, I don't believe this. This is the negative self-talk in your head. I can't believe you said this. I can't believe you didn't say this. I can't believe we'll never get to do this. Whatever it might be. Then they repeat that empowering statement out loud so that they can feel the power in that statement. And it reifies the belief that everything's okay. That they are loved. That they are human, that human beings make mistakes, that they are no longer the same person that made that mistake, whatever it might be. They have grown in that experience. In the next session, we're going to talk a little bit about finding meaning, dealing with special populations, people who are dying, people who have lost significant others due to special circumstances. We're going to talk about the parabolic experience next week. Okay.